Hello, welcome to this NMC OSCE YouTube tutorial video. My name is Hannah. I'm a UK registered nurse, university lecturer, and I've been an NMC OSCE programme lead. If you're new to my channel, I just share lots of help and advice and teaching to support those nurses that are self-sponsoring and self-studying for their OSCE exam. If you are new, also please subscribe, like and share my videos. So in this video, I'm going to look at the bowel assessment. So this is one of the clinical skills for the adult nurses. Had some requests for this. I'm going to go through the requirements of the station. We're going to go through two worked examples with some answers as well. So make sure you watch all the way to the end. Okay, so this is a totally silent written clinical skills station. So you might be relieved to have a bit of a silent written station in your OSCE and have a break from verbalisation. You've got 8 minutes to complete this station, and you will need to correctly identify the stool sample, which they provide you as part of your scenario, and document this using the Bristol stool chart, which I'm going to go through today. And you need to complete that documentation correctly and make sure it's signed and dated, etc. And then you need to write a care plan, so the interventional part of a care plan to related to your scenario. So commonly you get either a patient that's constipated or a patient that's got diarrhea. Obviously those are two kind of problems, and you need to write some appropriate evidence-based interventions for those patients. Like I said, be prepared to get a constipated patient, so a type 1 or type 2 on the Bristol stool chart, or a diarrhea patient type 6 or 7. The bit in between, 3, 4, 5, is kind of classified maybe as normal, so we wouldn't really need to be writing a care plan for that patient. So as part of this station, you'll get a Bristol stool chart. So the Bristol stool chart is used basically to classify human feces, and it helps us identify patients that might have different GI issues. Obviously helps us identify patients that have got constipation or diarrhea and are outside of kind of normal bowel habits. And we use this very frequently across all kind of healthcare settings. And it's a scale of 1 to 7. So 1 is, and 2 are patients that have got constipation. So this is where we've got separate kind of hard lumps, or like those little rabbit dropping individual kind of nuts or parts to pass. Type 2, again, is like a sausage, but it's quite lumpy. So you can see kind of those defined kind of ridges in it. Looks kind of like a constipated stool. 3, 4, and 5 is kind of, well, 3 and 4 is kind of normal, so that's that kind of normal sausage-like appearance. There might be some cracks on the surface, or it might be smooth. 5 is just approaching it into that kind of loose stool area, but they're soft blobs and they've got some clear edges. Then 6 and 7 are your diarrhea or watery type stools. So they are very loose. They might have some ragged, fluffy edges, or they might be totally water-like in appearance. So that's the Bristol stool chart. You'll see on the left there's somewhere where you need to document the date and the time, and somewhere where you need to put your initials. You can also add any comments, so the size of the stool, for example, if there's any blood or any mucus. So we'll do a worked scenario here for a patient with constipation. So you'll have a scenario and you will have a picture of a stool. I've just used a computer generated picture here, but you might have an actual picture of a stool. But the YouTube community guidelines most probably wouldn't appreciate me putting actual pictures of feces on the channel. So here we've got Mary. She's been in hospital following a knee replacement and is complaining of abdominal pain and having difficulty going to the toilet. She reports passing the stool as seen in the picture below. So the first thing we're going to do is go to our Bristol stool chart, and we need to correctly identify where that picture of that stool and the clinical information you've got, where that patient is. So I've put Mary down here as a type 1, so separate hard lumps, like nuts, and hard to pass. So we're just going to put a cross in the box. I'm going to put the date. You might have a set time for your scenario, or just use the actual station time that, you know, when you are sitting that station. And I'm going to put my initials here. So that's the first part that I need to do correctly. And again, make sure your date and time and it is initialed, otherwise it will be a critical fail. Then I need to go on and think about some care plan interventions. So for someone that's got constipation, and actually there's some really common advice and health promotion advice that we would do for a patient with constipation. So firstly, I'm going to recognise that Mary is experiencing constipation. This is most probably due to reduced mobility post-operation, and potentially she might be on some post-operative analgesics, which like opioids, that could be causing some constipation as well. She might also have just reduced diet and fluid intake, following the theatre. So what care point plans am I going to put in this care plan? So like I said, guidance used to be 5 to pass, but I've put a whole selection in here. Obviously, the more you know, the more you've got to draw on your exam in case you forget one. So firstly, we want to think about diet. So we want to try and discuss with Mary the benefit of increasing fibre and fruit and vegetables in her diet. It's very important when someone's got constipation. We would consider escalating to the medical doctors for a prescription for laxatives. We'd want to assess Mary's fluid status and for any signs of dehydration. Obviously, dehydration and reduced fluid intake is a big cause of constipation. And so we want to try and increase and encourage that fluid intake to 2.5 litres a day. We'd want to encourage mobilisation as well. So to encourage Mary to start to mobilise and increase physical movement where possible. We want to explain to Mary not to ignore the urge to defecate. So when people are very constipated, there's a bit of a fear about then going to the toilet and it being comfortable. So just reassuring her on that. And we want to try and educate and support Mary to have positive toilet habits, so ensuring there's privacy, good positioning. So maybe with the feet slightly raised from the stool is very beneficial, maybe some breathing exercises and just spending that time on the toilet. If there is some opioid analgesics in the scenario, then I would request for a review and ensure that we can give some alternative non-opioid analgesics, as they're a big cause of constipation. And we definitely want to put a point about reassessing Mary's bowel movements, and we should be doing that every 24 hours using the Bristol stool chart. So lots of points there. And again, just draw on your nursing knowledge, draw on how you would normally manage constipation and put them into a care plan. So scenario 2, so we're going to look at the other end of the spectrum. So this is a patient that's got diarrhea. You could have an infective cause of diarrhea or a non-infective cause of diarrhea. So just read your scenario carefully. So here we've got Josh, was admitted 3 days ago following a urinary tract infection. He's been on IV antibiotics and coamoxiclav. This morning he reports frequent loose, foul-smelling stools, up to 6 episodes in the last 24 hours. He's feeling weak and has abdominal cramping. And we've got a picture of a very loose, watery stool there. So where would we document this? So I would document this as a 7, so watery, no solid pieces, cross or tick in the box, my initials, the date and the time. And now we need to think about a care plan for someone with infective diarrhea. This is most probably a C. difficile scenario because the patient's got a history of antibiotic use, and that antibiotic use disrupts your normal gut flora, and you get the release of toxins, which basically damage the inside lining and cause inflammation, increased secretion of water, and kind of results in your diarrhea. So this is an infective C. difficile based on the information in that scenario. So what am I going to do? So I need to think about 2 things here: managing the diarrhea, but also preventing the spread of infection as well. So my care point plans would be for Josh will need to be barrier nursed in isolation to prevent the spread of infection. I'd need to collect and send a stool sample for culture so we can definitely identify if it is infective. Maybe give some temporary diet advice around reducing fruit and vegetables. We want to assess Josh for signs of dehydration and encourage an increased fluid intake. We want to also regularly assess Josh's perineal skin integrity for soreness, because obviously when someone's got a lot of diarrhea, that area is going to get very excoriated. I'm going to support Josh with just some privacy and making sure they've got close proximity to the toilet and commode. So just thinking about privacy and dignity there. Going to continue to assess Josh's bowels every 24 hours using the Bristol stool chart. And again, because this is possibly is an infected case, we're going to educate Josh and his family on hand hygiene with soap and water, not alcohol gel. Remember, alcohol gel does not get rid of the C. difficile, and we need to promote soap and water. So points there as well. Again, you need a minimum of 5 to ensure 5 good points to ensure a pass on the station. So I hope that's been helpful for you. Quite a straightforward station. Just make sure you practice with the timer on, that your writing is clear and legible, easy to read. And again, draw on that nursing knowledge. Think about how we manage patients with constipation and diarrhea. Be familiar with the Bristol stool chart, and always make sure that you have completed that correctly. Please follow my channel and share it. Thanks for all your comments. I try and answer those as much as I can. Don't always know the answer, but I try and use my nursing experience and experience of the NMC OSCE exam to help you as much as possible. I do offer one-to-one and small group tutoring, but I get booked up very far in advance, so just bear that in mind. I've also got a new e-learning platform which I'm trialling for nurses who want to have some additional support for self-study.